Great, good. I'll go ahead and get started here. It's nice to see everybody here virtually. Again, just to reintroduce myself, my name is David Talavera. I'm a pain psychologist here at the Stanford Pain Management Center. I'm very excited to go over today's lecture here. I'm truly passionate about this topic here. And just to tell you a little bit about myself, I've been here at the Stanford Pain Management Center for 3 or 4 years now, and I specialize in physical pain. With that, I hope today to give you an overview of what cognitive behavioral therapy looks like, in particular for chronic pain treatment. So without further ado, I'll go ahead here and get started. Great. So starting off with this first simple question here, but there's a lot to it. And it's a very common question I get here. Me, myself being a psychologist working at a pain clinic, where we treat real physical pain. How does psychology fit into treating chronic pain? So I wanted to start off there to set the stage here for this lecture. So I'd like to start off by going over the definition of pain. This definition was put forth by the International Association for the Study of Pain. It's an institution dedicated to research and education on pain treatment. And their definition is this: an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. So the treatment of psychology, or psychology, I should say, is actually integrated into how we understand and define physical pain. So it's not only a sensory experience, sensory meaning what we can experience with touch or physical experience, but an emotional experience as well. So all this to say, psychology is actually built into the definition of physical pain. So before I go into cognitive behavioral therapy, before I talk about what that looks like, what to expect in CBT or cognitive behavioral therapy when thinking about chronic pain, just like I mentioned with defining chronic pain, I'd like to also go over how pain is processed in the body. When we're able to understand how pain is processed in the body, we're better able to treat it. So when we're thinking about pain, imagining this individual has pain in their forearm, this chronic type pain, and that's the type of pain that I'm referring to here. To understand how pain is processed in the body, I'll go over the gate control theory. What it is, it's really an understanding of how pain is processed in the body. I want to take you behind the scenes, so to speak, behind what's going on when you experience real physical pain. So to do that, before you even experience that physical pain, that sensation is actually a signal. And that signal travels through our peripheral nervous system, nerves extending throughout our body. That signal then enters the spinal cord. And once it enters the spinal cord, it's our central nervous system. Our central nervous system is our spinal cord in our brain. That signal, once it enters the spinal cord, travels up to the brain. And in our brain, it's filtered through these processing centers, our emotional center, our thought centers as well. After that, that signal is then communicated from a top-down process that goes to our spinal cord again, through our peripheral nervous system, and into that pain location. So what's happening here is a complex communication, bottom-up and top-down pathways that happen extremely quickly. But that's what's going on behind the scenes. And not just in this example, but with how we understand chronic pain. So to really summarize here and emphasize these points, your pain, the physical pain you feel, is real. That chronic pain is a real physical pain. And pain is biologically processed in your brain. And our emotions and thoughts are part of that pain experience. So thinking about how that signal travels through the nervous system is filtered through these processing centers in our brain, incorporated in those areas to experience pain goes a long way. Understanding that goes a long way to treating chronic pain. So with that understanding, and before I go on, I also want to say that if you're interested in more information about this process, about gate control theory, more of the science behind it, Dr. Kauza gave a great pain science lecture series on this in July 2020 on our Stanford YouTube page. And so I encourage everybody to look at that video as well. But moving forward here, when we're thinking about chronic pain, I encourage everybody here to think about the impact that this chronic pain has had on your life, whether it's been 3 months with this pain, 3 years with this pain, or 3 decades with this pain. I'm sure you'll think about the emotions that have been impacted because of this pain, the emotions that pain has brought along. I'm sure you've maybe noticed the way you think has also been impacted, the types of thoughts that have been brought along by this pain, and how much you can do physically day to day because of this pain. Those are very common impacts of chronic pain. And what we also know is that every one of those things, the emotions, the thoughts, and how much we can do, impact pain as well, even if they're being derived from chronic pain, like fear or sadness. That emotion that comes from pain can in turn impact pain itself. And I'll unpack that in a bit, but just to illustrate this point, every one of these factors, our emotions, our thoughts, what we do, are both impacted by pain and impact pain itself. And it's also easy to understand how these things are related to one another, right? What we feel emotionally will impact how we think. What we do will impact what we feel. And what we feel will impact what we do, so on and so forth. These things are interrelated here. And the main point here is that every one of these things, our emotions, our thoughts, and our activities, are not only interrelated, but they impact pain as well, the experience of pain. And overlooking these things, overlooking our emotions, our thoughts, and our activities, leaves a lot of people trying to cope with this pain without the necessary tools to actually make progress in their treatment. So that's where cognitive behavioral therapy comes into play. This is what CBT is. CBT incorporates skills and tools to help cope with the emotions that come from pain, the thoughts that are impacted by pain. And within CBT, we have strategies and skills to help pace activities and do more despite pain. Now, this does not mean that our emotions or thoughts are solely causing physical pain. It's more than that. What this means is that this pain is impacted by every one of these things, and CBT incorporates that information. So going forward here, I'd like to actually zoom in within CBT. So if you're ever recommended CBT by your medical doctor, by your OT or PT, by your chiropractor, I want for you, and I hope that you have an understanding of what CBT is. And that's what I want to go over today. I want to go over what are some common techniques in CBT and how that applies to pain, the science behind that relationship, and really let you know what to expect in CBT. And to start off, I'd like to start off with this first connection here in no particular order, starting off with this relationship between our emotions and chronic pain. So with chronic pain, it's common, in many cases it's expected to have different emotions be derived from this pain experience. It's common, it's understandable to feel angry, frustrated, sad, fearful, anxious because of this pain. And what the research tells us, what years of research tell us, is that these emotions that can derive from pain impact pain itself. The research behind that shows that, and the reasoning behind that is because the amygdala, this area of our brain, is part of the neural system involved in emotion processing. And this same area in our brain, the amygdala, actually plays a role in pain processing as well. I find it very interesting on the bottom here. It says, when pain is induced in a lab setting, and yes, there are studies out there that induce pain for healthy individuals. People sign up for these studies knowing that they're going to experience pain. And in these studies, among healthy individuals, there's increased activation of the amygdala when that pain is experienced. No matter what type of pain is induced, whether it's a shock, pressure, heat, the amygdala lights up in our brain. What we also know is that it's been shown that stress, anger, sadness all impact the pain experience as well. There's a bi-directional relationship between how you're doing physically with pain and how you're feeling emotionally. So if we take a look at one of these emotions as an example, the fear and anxiety that could come with chronic pain. If we think about what's happening biologically with this example, with this emotion, we're feeling stressed or anxious or fearful, adrenaline is automatically released, cortisol is released, our pupils expand, we feel that muscle tension, our heart rate increases, we start to breathe a little faster, our blood vessels, they constrict. All of these things are activated automatically, biologically, to stress and fear, no matter where it comes from, whether it's the pain, whether it's a bill we didn't pay, whether it's preparing for this lecture like myself. That's our biological response to a stressful event, something that we consider stressful. What all of this is, and you may have heard of it, is the fight or flight response. The technical term is the sympathetic nervous system response. Our body is changing to react to this stressor, to fight it, or fly away, or flight. And what's interesting here is that the sympathetic nervous system activation, the more constant activation of this nervous system response, the more one can feel pain. And think about how stressful pain is. Pain is and can be very stressful. And this system can be activated for many people weekly, daily, hourly. And this same response that we have can impact chronic pain. Stress can impact how much pain one feels. So in CBT, what we focus on is learning ways to actually regulate those automatic responses to stress, fear, and anxiety. And we do that by learning relaxation-based techniques. And these techniques, we have skills like guided imagery, diaphragmatic breathing, progressive muscle relaxation, that are meant to provide more than just taking a break or feeling relaxed. It's meant to actually cope with pain in the moment. Because when we practice these skills, our body also responds to that relaxation. Our pupils shrink, our muscles automatically feel a little bit more relaxed. Our heart rate decreases, our breathing slows down, our blood vessels, they widen. This is also a biological response. It's a parasympathetic nervous response. And in this response, the more that we can have this calm, soothing nervous system, the better it is for pain. So that's one technique that we use in CBT. We go over those strategies, either in a group setting or one-on-one, and we learn how to use them in moments of high pain, in moments when that pain is on its average levels as well, to cope with stressors that come along with pain. Along with that, other techniques that we have are these other strategies to help cope with emotions as well within CBT. One of those is an expressive writing technique. In expressive writing, what's often recommended is to write for about 15 minutes about what comes to mind, to write about emotions, thoughts. Sometimes it can be helpful to just express those, to put them out of here and here onto a piece of paper. That can be a way to cope with the emotions. And again, coping with the emotions can be a helpful way to cope with physical pain. It's not going to completely eliminate pain, but if we can better cope with it, that's a step in the right direction here. So expressive writing is one of those ways. And there's been research showing that this type of writing can reduce depressive symptoms, it can reduce anxiety. And again, working with a therapist who specializes in CBT for chronic pain can provide more guidance for you in particular to know what to write about, how long to write for, what emotions to concentrate on, all to help cope with physical pain. So those were just two examples there. In CBT, there are a variety of techniques that we use to help cope with distressing emotions that come from pain or outside of pain as well. There are, on the top left there, those relaxation-based strategies like diaphragmatic breathing, progressive muscle relaxation, guided imagery, expressive writing there on the top right. We also review other techniques also to help out with distressing emotions like mindfulness, identifying and scheduling pleasant activities, scheduling worry time and constructive worry. And I put this up here just to give you a sense of what else is out there in CBT. Those relaxation-based techniques and the expressive writing are not the only things out there. It's part of a skill set that you can learn in CBT to simply just help cope with the emotions that come with pain, that are part of the pain experience. So going back to this CBT model here. And next up, I'd like to talk a little bit more about the relationship between our thoughts and pain. Think about, for everybody listening here, if you can think about what thoughts have come to you when that pain goes up. Not only the emotions, maybe of fear or sadness, but what's the actual content of what you're thinking about? Sometimes we can walk right over that thought and go straight to the emotion of fear, anxiety when that pain goes up, or when that pain is at its average levels as well. But if we take a second to think, okay, wait, what am I thinking about right now? It's making me feel stressed, angry, frustrated, in addition to this pain. Some of these common distressing thoughts are, very normal, common ones are, there's nothing I can do to help with this pain. I'll never be happy because of this pain. I feel worthless because of this pain. I'm scared my pain will get worse and I won't be able to cope. Again, these thoughts are normal with pain. They're common with pain, I should say. They can happen often with chronic pain. Think about the emotions tied to these different types of thoughts. The sadness, the fear, the anxiety with these thoughts that pop up automatically with pain. I want to point out two important points here. That everybody in this world, people with pain, people without pain, at one point or another will have unhelpful thoughts. And unhelpful thoughts are thoughts that make us feel sad, angry, anxious for a prolonged period of time, where we have to think about how do we cope with this unhelpful thought. And the other point here is that they're common. They're expected at times with this type of chronic pain. So why do I bring this up? Well, there's a wealth of research out there showing how these unhelpful thoughts about pain impact pain itself. So there have been studies showing how the increased presence of these unhelpful thoughts are associated with increased activity in areas in our brain that process physical pain. The more individuals had these unhelpful type of thoughts associated with pain, the more areas in their brain that lit up during the studies and fMRI studies in areas that process physical pain. Those areas being the primary somatary sensory area, the secondary somatary sensory area, the dorsolateral prefrontal cortex, and so on. So the point here being these unhelpful thoughts are associated in areas that process pain. And certain unhelpful thoughts are also associated with experiencing increased pain intensity, so how much pain you feel, and attentional processes towards painful stimuli. In other words, how much attention we pay to that pain that we're feeling. So not only are these types of thoughts thoughts that are involved in pain processing, but they can actually impact how much pain we feel and how much attention we pay to the pain. So again, understanding how pain works helps us better treat it. So that's what we do in CBT. We take a moment to identify these thoughts, challenge them, reframe them in some way. To talk about that a little bit more, just to use an example here. Let's say that this is a thought that someone has with chronic pain. They're having this thought constantly, I'll never be happy because of this pain. In CBT, we have a tool that I'll compress here just for your information that is helpful in coping with these types of thoughts that are common with chronic pain, that impact chronic pain. The first step is catch it. And this tool, the name of it is the 3 C's. The first C is catch it. Identifying that thought is a helpful first step. Because again, sometimes we can walk right over that unhelpful thought and go straight to the feeling of sadness, despair that this person might be feeling. But if we take a second to think about where is this feeling coming from, I fear or I feel like I'll never be happy because of this pain. In this type of therapy, in CBT, not only do we identify this thought, but we also question it. And that's the check it part. Is this a helpful thought or unhelpful? If I had this thought every day, every moment, how would I feel? Then we can really start to see, is this helpful Is this not helpful for me? And so with your therapist, what can be helpful here in CBT is to actually challenge this thought. What evidence do I have that I'll actually never be happy again with this pain? What evidence do I have for it? Are there examples where I've actually been happy? Moments where I've been happy despite pain? So once we start to really question that thought in a compassionate way, by really looking at, is this thought entirely true, partly true, not true at all? And what are some examples of that? We can start to change this thought. And I really want to be clear here that this is not only thinking happy thoughts. We're not here to only think positive. No, we're being realistic here. And that's very different. So in CBT, we take that approach. So after this kind of questioning of these types of thoughts, we can come to a thought that's a little bit more balanced. It's not entirely unhelpful. It's not extremely positive where we're unrealistic. We have this more kind of balanced, realistic perspective of our situation for that moment. What that can look like is something like this, where we can think, okay, yeah, this pain is difficult to cope with at times, but I also have many moments of joy with my friends and family. I have some tools I can use during difficult periods. And we can lean on this thought a little bit more when this initial unhelpful thought pops up, and it will, and it does. So we do this in CBT for these different types of thoughts. We take our time with it. And today, again, I'm just giving a general overview, but this is how we work in CBT. This is the work that's done in CBT. And again, there can be profound changes in how we experience pain with these techniques. So just like with coping with emotions, with coping with distressing or unhelpful thoughts, we have a variety of techniques that we also use, that we also go over in this form of therapy. We have mindfulness-based strategies, challenging unhelpful thoughts, which I just went over. We have coping statements that we come up with patients with chronic pain, and we see individually what helps that person feel better, because one coping statement's not going to help everybody. So not just with this, but with CBT in general, it's very personalized for you and your type of pain and your experience. And along with that, we establish soothing activities when those unhelpful thoughts come up. We also run through cost-benefit analysis, short-term, long-term pros and cons lists. We think through it. And it's not thinking away the pain by any means. It's coping with those unhelpful, distressing thoughts when they pop up. Those thoughts that are normal and common with chronic pain. So, excuse me, that brings us to this last section here. And that's activities, doing things. And I'm not only talking about exercise, but even simple things like laundry, loading the dishwasher, sitting in front of a computer for a lecture like this. Those activities can be impacted by chronic pain. And I'm sure that you have many examples and experiences of your own life of that impact. A very common experience with chronic pain, something called the chronic pain cycle. And for those listening here today, think back to your experience of pain. See if you've ever noticed anything like this before, where this chronic pain increases how much we cannot do day to day. We have decreased activity, and because of that, maybe deconditioning. Our muscles deteriorate the less we use them. After that, because we're not doing enough, we feel not the best emotionally. We have these negative emotions come up for us often. Because of that, we might tend to withdraw a little bit more from others. We might avoid certain situations because we're fearful of this pain, very common experience. And because of that, it raises our overall level of distress and disability. And because of all these things together, it impacts pain. It increases pain, and the cycle continues. And people can be stuck in this cycle for weeks, months, or years. It's a tough cycle to be in. So in CBT, we not only go over this information, but we go over skills to break this cycle. One of those techniques is thinking about how do we increase activities. And what the science tells us behind exercise, behind movement, in chronic pain, is that safe movement, exercise with chronic pain has a lot of benefits. In these studies and this information that will come up, these are all 4 studies among individuals with chronic pain. And what we know about the research is that with increased activities, there's improvements in mood. People feel emotionally better with chronic pain after these experiences of exercise. People sleep better, and we all know how much sleep is impacted by chronic pain. And along with that, people have improved pain experience in the sense of pain intensity. People feel a little less pain as well. And with these exercises, people also with chronic pain have improved functioning. They might be able to get back to doing other activities, maybe work as well. So the benefits of exercise on chronic pain are numerous, and they're real. Now, doing the exercise, doing the activity, that's the tough part, right? So when we increase activities with chronic pain, a very common experience is doing too much. When we do too much, something that can happen is something that I've heard be called the pain tax. We pay the pain tax after increasing that activity to a point where maybe we've done too much of that exercise we normally do. We pushed ourselves to the limit with maybe loading or unloading the dishwasher. And it's tough because the intentions are great. You want to do more. Our physical therapist is telling you to do more. The medical doctor's telling you to exercise a little bit more. Now, doing it is a tough part. So in CBT, what we work on are strategies to pace these activities. And it takes time and it takes practice, but having paced activities can go a long way to doing more. And one of those strategies is time-based activity pacing. In a very condensed way here, in time-based activity pacing, what we're doing in this technique is we're using time as a basis for the activity. We're using time to gauge how much we can do that activity for. If we can do this activity, let's say laundry, for about 15 minutes without sparking a pain flare or exacerbating our pain to that 8 to 9 or 10 out of 10, then that's a good sign. But if we're pushing ourselves to that limit, to that 9 or 10 out of 10 every time, we'll pay the pain tax after that. We'll be out for the rest of the day, rest of the week, and that's what we want to avoid. So in CBT, what we focus on is learning a little bit more about your experience of pain, seeing what your limits are, and using time as a gauge in those experiences. And in working with your therapist, your psychotherapist here, someone who specializes in CBT, in conjunction with your primary care doctor or your physical therapist, we can come up with a plan of exercise and activity that's comfortable, that's safe for you to do. So as part of this time-based activity pacing, we'll stop even if you feel you can do more. And we can cope with those thoughts that come up of, I should be doing more. Here's another example of something else I can't do. These unhelpful thoughts that make us feel frustrated, sad, angry, very common emotions and thoughts. So this is where all of these things start to come together. And so with a CBT therapist, you'll actually establish a schedule to do that one activity. We're breaking it down in very small steps here. So this is an example of what that can look like in working with a CBT therapist for chronic pain. On the left is the physical activity. Next to that is how long that person would do that activity for. Next to that is a recharge activity. Taking breaks is an important part of these activities, and that's how we pace ourselves, or that's one of the ways that we pace ourselves. And lastly, we time out how much we're actually going to do that recharging activity before getting back out there. And so here, this person might do the laundry for 15 minutes and then pause, even though they can keep going, even though the laundry's not done. In this example, they can pause then and there. They'll practice a guided imagery exercise that they practiced with their therapist before. They time that out. They know the effects that that guided imagery, that relaxation exercise has on their body and their pain. And they're able to go back to that, alternating between the physical activity and this relaxation-based strategy to do that activity. And some people might say, well, gosh, this is taking me more. I can just push through for 20 minutes. But after those 20 minutes, in that example, that person might be pushing their limits, paying the pain tax afterwards. And that's what we want to avoid. And so, again, this is an example here. This is going to look different for everybody. And so in working with your therapist, you can find an individualized plan with consulting with your primary care doctor, your medical team, your physical therapist, to find comfortable and safe ways for you to do those activities that you want to do. So what our goal here with activity pacing, and I alluded to this a few seconds ago here, is after that activity, in this example here, going out for a walk, we still want to be able to keep going with our day and not pay that pain tax afterwards. So we do that by using this type of strategy, the time-based activity pacing. And that's going to look different for different activities, different days. And so coping with changes in pain, having that flexibility and self-compassion is going to be important in this process. And again, in working with a CBT therapist, those are emotions and obstacles that are absolutely pertinent in that treatment. So just like with the emotions and thoughts, these are other ways to help improve those activities when we're thinking about chronic pain. We have SMART goal setting skills. That's a specific technique named SMART goals. Time-based activity pacing, reviewed. You can work with a CBT therapist to identify and plan pleasant activities as well. Can't tell you how often I've heard of how many individuals with chronic pain will put pleasant activities like hobbies, things they like doing for fun, in the back burner. Those activities that bring joy, meaning, value in their lives are critical in coping with pain. So that's a big piece as well. In CBT, other techniques here are sleep hygiene, improving and optimizing sleep to better be able to do those activities the next day. We can go over communication skills so that you can have ways to effectively communicate. You know what? I got to take a break here. I'm sorry, but I can't go out for that long with my brother or my sister. I lost here. There it is. We can have communication skills to say what we need as well. I need some time for myself in this moment. How do I best communicate that? That is absolutely pertinent in CBT for chronic pain. And lastly, we also go over strategies for expanding that support system. With chronic pain, it often can feel like a solitary experience, but I'm sure it impacts those around you as well. It can impact how often we go out, how often we say yes to an activity because of that chronic pain. So it does and can impact those around you. And so in CBT, we work on ways to expand that social support in ways that are comfortable for you and this pain. So we're here after talking about every one of those sections here in CBT. And the point I really want to emphasize here is this, that in CBT, we're not only coping with the emotions for the sake of coping with the emotions. We're not only coping with those unhelpful thoughts to cope with those unhelpful thoughts, and the same for activities. We're learning skills and strategies to help cope with those emotions because those unpleasant, distressing emotions impact pain. We're learning techniques to help with those unhelpful thoughts because those unhelpful thoughts impact pain. So what we're doing here is pain coping. So there are a few highlights here that I want to go over before rounding things off. And these are highlights for CBT. The first of which being CBT is a non-pharmacological, goal-oriented, and skills-based treatment. Non-pharmacological in the sense of, we don't provide medications or procedures. Goodness, no one would want me in a procedure room as a psychologist, but we know that this form of therapy can help and does help for better managing chronic pain. And we do this because it's goal-oriented, it's targeted, and it's specific for chronic pain. In terms of its duration, it can vary. Some people might need more longer-term care in CBT. There's also been some good effects on briefer sessions, 4-session treatments as well. Again, this will depend on you, the type of pain, the type of experiences that come along with pain for you. Next, CBT is considered a gold standard in psychological treatment for chronic pain. When used in conjunction with your medical team, physical therapy team, having pain psychology part of it really elevates pain care. And so much so, and this is the point here, this last point is a point that I find fascinating, that after, and in this particular study, what they found was that after CBT treatment, the brain can have stronger top-down control of pain. Our brains physically change after CBT to better control pain. So, and that takes time and that takes work, but the tools are there. And again, this doesn't mean that this would replace all of your treatment, but when used in conjunction with the plan in place with your medical team, when used in conjunction with the plan in place by your physical or occupational therapist, this can really enhance chronic pain treatment. So I go back here to this chronic pain cycle, how this pain can impact how much we do, impact our emotions, make people feel withdrawn, avoid certain interactions. It can increase our disability and distress, and all of this can impact pain more. A very common cycle in chronic pain. I mention this again because what I just went over are a few skills, among others, that can directly target this pain cycle. And you don't have to be in this cycle to benefit from chronic pain, but I want to illustrate how CBT can be helpful for this example as well. In CBT, we have different areas of breaking this cycle. We go over chronic pain education, like I did in the beginning here, how pain is processed in our body, going behind the scenes, so to speak, in terms of what's happening in our nervous system when you experience pain. We go over those relaxation-based strategies to actually learn how to better regulate our nervous system through guided imagery, progressive muscle relaxation, diaphragmatic breathing. We go over, separate from that, mindfulness techniques as well. Coping statements, like I mentioned. We go over ways to do a little bit more with time-based pacing strategies, weekly goal setting, We find ways to help cope with the emotions that come with chronic pain, processing those emotions, challenging unhelpful thoughts, working with your therapist for problem solving as well. We expand that support system. We go over ways to communicate needs in effective ways here. And we also have, and again, I mentioned this earlier, space to talk about how do we identify and increase things that you want to do for fun, not things that you have to do, but things that you want to do as well. That's also pain treatment. And that's also integrated into CBT because it is important in the pain experience. And all of these tools together can help you feel more equipped here. All of these tools together, you can use them when needed for coping with chronic pain. So with that, before I go on here, again, I really want to emphasize that with this type of treatment, it not only can help in the short term with pain, but long term as well. It can have structural changes in our brain to better cope with pain. And I think about that and I review that often with individuals in my treatment, that these skills are not just short term, but long term. So with that, I'd like to quickly go over here before I end some other resources that we have, and many of these that are CBT based. There's a lot of relaxation-based strategies. There's a lot of relaxation-based strategies here through the Calm and Headspace app on the top left. I personally use the Calm. I really like that app. I've heard a lot of great things about the app on the bottom. Sorry about that. Uncurable. And on the right there, the CBTI coach as well. I encourage you to look into these. The one on the bottom, Curable, is pain specific. There's also books here that we recommend. I'd recommend any of these to learn more about these CBT strategies for coping with pain. These are my references here for today, and we're here at the end. I also want to go over quickly here additional resources that we have. We have virtual pain psychology classes at our clinic. I'd encourage you to speak with your provider, your psychologist, to see what would be most helpful for you for these types of classes, or if there's any other types of therapy out there that might be more helpful for you. There's also virtual education and support resources as well, including this one, the Pain Science Lecture Series, every first Monday of the month. We have the American Chronic Pain Association information there as well. Support matters here. So that's a support group here for chronic pain in particular. And then lastly, the Miles for Migraine Community Support Group as well. And so I encourage everybody to look into those support groups to have more of that, to help cope with pain. But with that, I'll end here. It's been great to go over this information with everybody. I truly hope that you learned a little bit more about CBT, and in particular how it can be helpful for coping with chronic pain. But with that, it was great providing this lecture, and thank you, everybody.